All right, so thank you everybody for joining. Gonna have another session today, continue of the webinar educational session for Sudan House. As you guys know, this is a series that has been going on for a while to provide some educational level. So I would like to thank Dr. Amani Tahir for her leadership in figuring this program started. It takes a lot of work and leadership, and also Reed Hussein. She's also been a very vital member of making this happen. And then also thank Dr. Sahar Osman and her guest for providing some time to provide this informative session. So we're gonna have a presentation. At the end of it, we're gonna have Q&A. Now I'm gonna turn the mic to Dr. Amani.
Hi, everyone, and thank you for joining us today in this session. It's really the major objective of this series is to prepare our kids and to prepare even ourselves and the adults who want to seek educational program in the US here. And I'm really glad that we have the youth joining us to also help us with this awareness. So I want to thank Dr. Reach for doing that and leading these specific initiatives. And also I'm thanking our participants today, Dr. Sahar and her colleague for joining us today. Looking forward for this session. Thank you very much.
Good afternoon. Assalamu alaikum, everyone. My name is Eddie Jwadia, and I'm also thrilled to welcome you to our fourth virtual session hosted by our Sudan House Education Committee. Like everyone has said, these sessions aim to introduce our youth, but also the wider Sudanese community to different career paths within healthcare. So today, we're constantly featuring amazing Sudanese healthcare professionals, and they come on and they share their insights and their experiences, and really, they're very valuable to us. Today, it's my honor to welcome not one, but two incredible speakers. Joining us is going to be Sahar Osman and also Madeline Mavola. I hope I said your last name correctly. Correct me if I'm wrong. Both of her, like I said, are physician assistants. Sahar is originally from our Greensboro Sudanese community, and now she resides in Doha, Qatar. Despite the time difference, she was gracious enough to come on here and share her journey with us, tell us more about her profession, and really advise anyone who's interested in the profession. Madeline Mavola is a close friend of Sahar and also a fellow PA. She will also be sharing with us her experiences, any insight about the field, and just offering like additional perspective for our youth in our community. Before we get started, I do want to mention some housekeeping things for our audience. Make sure your microphone is muted when you come into the room, and also when our speakers are speaking, just so we can give them our undivided attention, and to also just eliminate any kind of background noise. But do feel free at any point to type any questions in the chat. And at the end, like Dr. Khalid said, we'll open it up to a Q&A, and you'll have, the opportunity to ask your questions. Sahar and Madeline, we're truly honored to have you both with us today. And on behalf of Dr. Khalid and Dr. Amani, I'd like to extend a warm welcome, and the floor is all yours.
Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you guys so much for having me over. It truly feels like being home. So thanks to all of my Greensboro, North Carolina family, and to all those who have joined. The uttermost thanks to Beit Sudan and their valuable work in the community with our president, Khalid Osman, and our rising star now, Arij. Thank you so much for bringing me along. I'm very happy to join you guys today. I'm gonna just kind of be doing a presentation over the physician assistant program in general. So with that being said, we'll go ahead and get started. So these are just a few slides that I put together just to kind of break things down for you guys. And of course, at the end, we'll do a Q&A session to answer any questions that you may have. I also am very happy to say that I do have my very good friend and sister Madeline here. We grew up together, so a lot of people in the Sudanese community actually have, she's a familiar face to them, but she's a PA as well. And she came to Doha to see me, so I feel very special, but it's very good that she's here. We're gonna take the opportunity to also get her involved in the conversation, and if you guys have any questions, you can ask her. She'll tell you a little bit more about herself at the end. So with that being said, let's go ahead and get started. All right, so introduction. The role of this presentation is basically to explain what PAs do and how to become one, and of course, answer any questions that you guys may have. A little bit about me. So I graduated from UNCG with a Bachelor of Science in Biology in 2009 and a Master's in PA Studies from Elon University in 2015. And that is when obviously I began my PA career. I'm currently in Doha, Qatar, and I work in an outpatient clinic. Previous job experience, I've worked at Moses Cone as an internal medicine. In the internal medicine department, I worked at various urgent care clinics, and I've done telemedicine. So that's kind of my background. So what is a PA? I think this is like the most valuable slide. There's been a lot of just kind of like unclarity and uncertainty about exactly what a PA is. The big thing I want you guys to take away today, the biggest thing is we are not a physician's assistant. So if you really want to offend a PA, you will say you're a physician's assistant, which by no means, it doesn't underestimate our role as assistants to physicians. However, we're not their assistants. We are colleagues, we work with them, we're healthcare professionals that work alongside with them. So we're not a physician's assistants, we're a physician assistant. But the official definition, according to AAPA, which is the physician assistant organization, PAs, and that A should have been capital, I apologize, but PAs are licensed clinicians who practice medicine in every specialty and setting. Trusted, very hardly educated, very hardly trained healthcare professionals. PAs are dedicated to expanding access to care, and that's a big thing, and transforming health and wellness through patient-centered, team-based medical practice. So just to kind of expand a little bit on those terms. So the big idea of physician assistants, which if I'm correct, I think it may have started in the early 60s or so. I know I had to do a little bit of homework on that, but the point is there was a identified shortage of healthcare professionals, and that is where the PA program kind of was birthed, and it was around a need where family medicine, just general doctors were just not enough. And then they wanted a quicker way to get people out there in the field to help kind of close that gap. And that is where, or how PAs became, the profession became, or again, was developed. All right, so that was the important slide. But this is really, really the important slide because PAs, and I don't know if the slide kind of came a little bit early, but anyways, PAs, this is basically the mean average wage of physician assistants by states. And so the slide came a little too early, I want to say, but in either case, you guys can see that the annual mean wage for PAs starts from 88 to 120. But really, if you see, that's like the very light blue, and that's like really not in a lot of states. So if you can see the kind of like the medium blue is the main color, and that's where we're seeing from 128 to 134,000 roughly. Things depending on the specialty, depending on the use of practice, you can actually have an income from 136 to 154. This is from the BLS website, and this is a pretty recent May 2023 wage by state map. All right, settings. So where do physician assistants work? So practice setting can range from hospitals to outpatient clinics, research, education, telemedicine, the armed forces, federal government facilities like prisons, or community rural health clinics. So this is to say that PAs practice in almost every setting. All right, a few of the different specialties. So again, just like settings is very generalized, specialties can be as well. So I want to say in mostly every specialty, you can see the work of the implementation or the hiring of physician assistants. So specialize in various areas: emergency medicine, inpatient medicine, family medicine, psychiatry. Where comes my friend Madeline? She's actually currently working in psychiatry, surgery, pediatrics, orthopedics. So basically any clinical setting, any clinical specialty. All right, so let's talk about what PAs actually do. So PAs typically work in places or in the different settings, like we talked, different specialties with other medical professionals, doctors, medical assistants, nurses, stuff like that. So in a typical setting, let's say an outpatient urgent care clinic, you will have a medical assistant that will room the patient, that will take their vital signs, that will inquire about the patient medication history, all the important aspects. And after they do that, they room the patient. So that's when the role of the PA or the PA comes in. PA takes patient's history, performs medical exams. They order and interpret lab and radiology tests. They perform procedures, diagnose and treat illnesses, write prescriptions, counsel patients on preventative health. So needless to say, they do what a typical MD might do. And they have the capability, just like an MD can. We'll talk about a little bit of the differences between them and MDs, but again, a PA in a lot of times will be someone that you ran into, that took care of you, that did everything, and you thought it was the doctor, but no, it's the PA. So that you're not seeing a patient hardly sees a physical difference between a physician assistant and a medical doctor. And honestly, there's been a lot of, with just the popularity of PAs or the PA programs increasing, and the recognition of the role of the PAs and how they're utilized and how productive and a lot of things, there's been a lot more use of PAs in a lot of different settings. And one of the main reasons is because the training of the PAs, and we'll talk about that in the next few slides. But another thing is from kind of like a financial perspective, a lot of practices would rather hire a PA that kind of can do the same job as a medical doctor before they hire a medical doctor, because of the expenses associated with medical doctors. Obviously, medical doctors have the rigorous training and everything they do, but again, we'll talk about the differences. But PA as a profession is growing, is flourishing. It's being the program of choice, or the study of choice now. So
Sorry, I don't mean to interrupt you, Sahar. Everyone who's on the call, please mute your mics. Baba, please mute your mic.
a few of the benefits of the PA program. So again, this could lead to kind of like the discussion of PA versus medical doctor. One of the major attractive thing is the length of programs. So you're going to school for less time than you would if you were to go to medical school. And this is a big attraction, because people realize and then they can get out and then they can work and make money quicker than if they went to medical school, number one. And number two, they have less debt. And that's a big thing too. So people are looking at it from a financial perspective. A lot of people that want or have the desire to be medical providers and are comparing the two similar fields, they end up choosing the PA program, because again, this is something that can end a little bit quicker. I can, instead of going to 5 to 6 years, I'm going to, typically it's 2.5. So 2.5 or 2 in a few months, and get my degree and go out there and work and make the money. Another big thing, and this is very, any PA that you will see will really speak highly of this, is that the ability to transition between specialties. So, in my career, like you guys have seen, I have worked in the hospital, I have worked outpatient, I have worked from home as telemedicine. So there's that freedom, or there is that possibility of transitioning, and even within each, I can do different things. So I can do surgery, and then I can come back and do pediatrics. Well, I don't like to see kids sick, and I don't want to take care of kids sick. I like to see them normal, not sick. But so then I go back to adults. So that freedom is a very big thing with the PA program. And I don't want to like talk a lot about the MD program because, but just another comparison, a lot of times with MDs, once they specialize in pediatrics, they kind of can't go from that. They have to do pediatrics, or if they're adults, they cannot see pediatrics. So there's a little bit of restrictions with the MD program that PAs otherwise, or those who are interested in the PA program, find attractive. And that leads to obviously a better family work balance. That was a big thing for me personally. When I went back to PA school, I actually had my daughter who was, I want to say 3 at the time, and she was 3 years old, and I ended up going back. So I knew I needed something that when I graduate, if I needed to be at home a little more, or if I wanted to take off, and I could, and you can actually do that. So when I first worked out of school in the hospital setting, I did the typical hospital schedule, which is 7 days on, 7 days off, which was great. But then I had my second daughter, and I couldn't really do that. I couldn't be away 7 days. So I ended up transitioning into outpatient medicine and did the less days. And then eventually I was like, as I grew in the practice I was in, there was introduction of telemedicine, and then I could really work from home altogether. So that was really wonderful. So just that ability, and especially for us women, I think that's a big thing. And especially for us people that value family life and things like that. So that was a big thing for me personally, but for any PA will attest to that. All right, this is the bread and butter, like they say. So how do you become a PA? A lot, obviously, that it entails, but we break it down, and hopefully this would actually kind of like help with a lot of the scatter thoughts and stuff about how to become a PA. First thing is the prerequisite coursework. So if you're in high school and you're entering college, the big thing you want to focus on is obviously studying towards becoming a medical provider. So you're going to be taking science courses, studying biology, chemistry. Even I've had friends that did like psychiatry, physical therapy, things like that, but you want to stick with the medical, with kind of like a medical background coursework. A lot of science, chemistry, physics, so that you cannot get away from, but obviously you'll have to do. You obviously want to stay up on your GPA and things like that, so you don't want to be a slacker, because that's not going to look good. But that's basically pre-coursework. A few other things, you're gonna have to take the GRE. I know there's a lot of question about that, like, oh, there's this school that doesn't have a GRE requirement. Honestly, I do not know if there's any school that does not take a GRE. So the GRE is a graduate something, I'm sorry. But anyways, a GRE is a very famous kind of exam that you have to take after you have graduated from your bachelor's. So you've done the bachelor's, you're completely out of that, and then you have to go back, study for the GRE, get prepared for it, and take that exam. And you have to score well if you want to be accepted into a PA program. A lot of PA schools are going to ask for direct patient care experience. So they don't want someone who just has a biology degree that basically finish their biology degree and now they want to go to PA school. You have to do a little bit more. You have to show a little bit more. And this is not just to show, this is actually a requirement. So the GRE is a graduated record examination. So that's kind of like an examination that a lot of graduate schools will require anyways, but definitely a big thing with PAs, PA programs. And so direct patient experience, they want to know how you have directly interacted with patients. So what do you know about that world, if you will? What kind of experience do you have? So things like certified nursing assistants can count. Those are basically CNAs, or like working under nurses. Medical assistants, people that, this is a degree program that you do, like I think it's like it's a certificate, I'm sorry, it's not a degree, it's a certificate program that you do, and then you get certified, and then you can work in different settings. But example, you can be the one that's taking vital signs of patients when they go into a clinic or in a hospital. And so you're having that one-on-one interaction with the patients. You can be an EMT and work in the ambulance. And with that, obviously you have the hours that you need. So they will ask for healthcare experience. I see some questions popping up. I'll go over the which is great, but I'll just kind of like keep them in the background until we go over the slide, and then we'll try to answer some of them. A lot of PAs are going to want to know how dedicated you are to the healthcare field in general. So volunteering work, shadowing. So they actually ask that you shadow a PA. Maybe you don't like the profession. Maybe you don't know enough about the profession. So, and you can't shadow an MD. It's a big thing with PAs. Like PAs is PAs, MDs are MDs. So the point is you can actually, they will ask for that. And then the big thing, which a lot of you guys know, is the CASPA. And as for those that don't know, so CASPA is a centralized application process, and it allows you to put your information in one database, like on the website, and then you're actually applying for multiple programs. So you don't have to go through each one and stuff. You know, a lot of the PA accredited programs, or a lot of the programs in general, are gonna be directly related to CASPA. So you just go through CASPA to know the requirements and then to apply. Sometimes some programs are going to ask for an essay, a separate essay, and that's going to be something that you have to work on, and something that you kind of present yourself and show yourself on. And then hopefully you've done all of this, everything looks really good, and then you get called for an interview. And then the interview you go to, PA school is very competitive. And so, you know, you're going to see an average of 800 to 900 applications per year, and 80 people are taken from those 800. So you have to really stand out. I think I was doing some research to put this slide together, and then that's kind of some of the numbers I saw. Not all of them are going to get 800, but you'll see that a lot of them are going to get a lot of applications, and that you have to truly stand out. And sometimes standing out, we'll talk about that, because I can kind of give you guys my personal intake on that. And the last thing that's here, do I have another slide that says continued?
I think this is the last slide, I think.
Oh, I think I have more. Maybe I didn't send the right thing then. Let's see.
If you could resend it, we could share it again. Yeah.
Okay, I apologize, you guys. Let me figure it out here real quick. But the last thing before I forget my train of thought that I wanted to share with you guys is دعاء. ماما تصلي وبابا يصلي والناس كلها تصلي وتعمل دعاء كتير عشان احنا عملنا الحاجات الجميلة دي كلها، والتوفيق من رب العالمين طبعا زي ما انتم عارفين. But I'm gonna go through my email real quick. I'm sorry. Are you sure that's all you have, Khalid?
Give me just a second. Let me see.
Okay.
Yeah, no. We still have, yeah, we still have, yeah.
A little bit more? Okay.
Yeah. This should be the next slide.
Okay.
Yeah. So interview, and then we go to this slide here. Yeah.
Yes. So so that's how we kind of set. Again, we made it into the program. Alhamdulillah, everything went great as we wanted. Now I am a PA. Well, actually, I went to PA school. I started PA school. I went to PA school, which I skipped literally 2.5 years, and I made it seem like it's just like that. It's really not like that. But again, you guys get my idea. You've completed the program. You graduate mostly with a master's degree in PA studies. So that's, you're actually, it's a graduate program, right? So it's a master's degree in PA studies. After which you must pass the PA national certifying examination. So you have to sit for a separate examination, not through your school, a national examination. And you must pass that, okay? You pass that, now you are a physician assistant. Once you are a physician assistant, you must complete continued medical education hours. And those are hours that you have to complete every 2 years. So you're going to conferences, different places, you're reading articles, you're updating yourself, you're doing things like that. And those you have to log in for every 2 years. You have like 100 of them, 100 credit hours. And just to give you an idea, you can do like a conference that you fly out to California and you stay for 2 nights or something, and you're doing some education there, meeting people, speakers, and you're sitting through that, and it's 5 credit hours or 10. You have to do 100 every 2 years. So you have to keep up with your training, you have to keep up with your skills, you have to keep up with your education. And then lastly, as far as requirement to stay as a PA, you must be recertified every 10 years. So you have to take that national certifying exam that you did after you graduated to get your license. Now you have to do that every 10 years. So this is basically the breakdown of how to become a physician assistant and how to stay a physician assistant. Let's go to the next slide. And as so the next big question is choosing a PA program. So now I know what to do. I went to CASPA. How do I choose, or what do I do? There are a lot of things to consider, but some of the most important things to consider is when you're looking into programs in schools is that you want to learn about the different programs. Okay, so you want to learn about this Duke's program versus ECU's versus, I'm sorry, ECU, I don't think ECU has one. ECU, so Duke, ECU, Elon, High Point University. So you want to learn about them, just get an idea, okay? Even if it's early on, it doesn't hurt. Get an idea just to know what you're interested in. Another big thing, and I think this is for us, I love to relate things that are ours, right? But location. So, you know, your dad may not be as excited for you to go out in California and study PA school. So you have to look at some of the local ones. And that was definitely my case because hence Elon. Again, the very cool thing, we have High Point University, which is just a drive down the road, down Wendover Avenue. They're both private. A lot of these schools are gonna be private, but you have that capability. We now have that. We didn't have that. When I went to school 10 years ago, we only had Elon, and that was the big thing. So, which thankfully Elon was a very strong program and still is very competitive, one of the top in the world. But again, the big driving factor for me, just to be honest, with location. I mean, I had my kid, I needed my mom with me. I couldn't up and leave anywhere else. So hence that was that. So that's location big. The length of the program, and I say this because most graduate schools are going to be about 27 months, 26 months, but you'll see that some are a little bit longer if you wanted to like certify, like have another kind of like specialty, which you don't need. But again, sometimes it can be a little bit longer. Sometimes it can be, well, it can be 24 months. And for someone, it's like, I just want to go for 2 years. I don't want to go for 2 years and 3 months. So one of the things to look into. Another big thing is with the popularity of the PA program kind of like increasing and more programs are being made and being put together, you have to be very careful because you want to make sure that you are trained and educated properly so that when you sit for that PANCE, the national certifying exam, that you will pass that. So you want to make sure, because again, it's a very competitive examination. So you don't want to have gone to school, paid all that much, and then you know, there's not a big chance that you're passing the PANCE. So make sure that you're looking at the PANCE pass rate of these schools. Again, the degree awarded, it's a master's, it's a I don't know much about bachelors of science in PAs. This must be like a new thing, but from what I know, a lot of these are graduate programs. So typically you're going to have a master's degree. And then the other big thing, again, is cost. If you can find scholarships, if you can find grants, that you can apply for, and then you get chosen and you're given those grants, it's going to decrease the cost, and that would be great.